This is a virtual reality exposure therapy session for treating PTSD. It's an immersive experience designed to help patients confront trauma from conflict zones.
Virtual reality is, in my field, a psychologist's dream. To be able to build simulated environments, put people in, observe how they respond, help them to respond differently to support their therapeutic goals. That's the essence of why we do therapy or human research.
And this field, known as clinical virtual reality, is growing, challenging popular preconceptions of VR as a novel gaming device to include advanced medical and psychological treatments. It's being used for conditions ranging from dementia to chronic pain, as well as providing training in remote healthcare sessions.
You know, what's amazing about VR, unlike any other audiovisual medium ever created, is how emotionally provocative it is. Because our brain was never designed to live in two realities at once. Like, that's not evolutionarily required of us. We just accept the reality that we're given. And so in VR, you feel, your brain believes that it is physically present in some other world. And that generates strong emotions.
Over the last 5 years, we've probably had several million people who've used virtual environments for addressing pain, for learning social skills, if they're on the autism spectrum, to improve their mood and to help address social anxiety disorders.
So, after years of intrepid research and positive results, can clinical virtual reality become a mainstream component of modern healthcare?
Okay, I'm just going to make some things happen. I'm going to set off some...
Dr. Skip Rizzo is a psychologist who's been working on clinical virtual reality for the last 25 years.
Prior to getting mixed up with virtual reality in the mid-90s, I was a clinical psychologist, and I was primarily working in brain injury and doing some work with anxiety disorders. I got frustrated with the lack of technology that could be usefully applied in the clinical areas, and when I found out about virtual reality, it just made so much sense to me. We could build real-world environments that we could immerse people in, and we could systematically control the stimulation or the stimuli in the environment. That to me was just an incredible opportunity for not only testing or training or rehabilitating function in functionally relevant environments, but we could also maybe introduce gaming factors into it so that we could enhance motivation.
One of the main areas where VR has been found to be clinically effective is in helping treat anxiety disorders and PTSD, using VR for exposure therapy. Exposure therapy helps a patient to confront and reprocess trauma in a safe environment until the symptoms connected with the trauma are reduced. Existing strategies include imagining or repeating the experience in real life.
The treatment of post-traumatic stress disorder in virtual reality follows the exact procedures of the evidence-based traditional approach, except we're putting people in VR simulations of what they were traumatized by or what they've been having difficult experiences with.
Right there.
We have the visuals, we have really good audio. We also have vibration stimuli that makes it so you feel like you're driving a Humvee, you're feeling the vibration. And we also use the sense of smell, where we can pop little scents into the experience that are reminiscent of what that world would be like: diesel fuel, gunpowder. And all of these sensory modalities create the experience of being back in the situation in a more realistic way.
Since 2005, Dr. Rizzo has led the Brave Mind Project, a VR therapy program that helps veterans with combat and sexual assault-related PTSD.
So you put the headset on them, you put them in this environment, and you have it at a very low level so that they can still feel comfortable, but they know they're getting towards confronting the challenges that they've been avoiding or they've been traumatized by. Then you ask them to recount their trauma as if they're experiencing it right now, and to speak out loud. I'm driving down a roadway and heading towards Fallujah in a Humvee, and I'm talking to my best friend, and all of a sudden I see somebody up ahead on the road, and they have a cell phone, and an IED blows up the side of our vehicle. And so they start to talk about what they went through, but meanwhile the clinician has the capacity to make the VR world reflect what they're saying. So in real time, we can make that IED go off. And so by doing that repeatedly and then systematically making it more challenging over time, you're helping them to confront and reprocess the difficult emotional memories from their traumatic experience in a way that actually leads to reductions in the core PTSD symptoms. The science is never complete. It's always growing and evolving, and we're learning new things every time we run a study, but we can stand pretty strong here in saying that the use of VR to deliver these kinds of treatment does have sufficient evidence for its clinical application.
Now, BraveMind is being used at more than 100 military bases, hospitals, and other sites, and it's proving popular.
People from our research anyway are more attracted to VR, and if they see VR as part of a therapeutic process, they have more of an interest in seeking help with VR. We've documented this with PTSD, where we asked veterans at the start of a study, if you had your choice between the traditional therapy or the VR therapy, which would you pick? 77% picked VR.
One of the early developers of VR for healthcare is Dr. Walter Greenleaf, a research scientist and behavioral neuroscientist working at Stanford University's Virtual Human Interaction Lab.
When I first got involved in working with virtual reality technology several decades ago, the systems were exciting, but they're very different than what we have right now. The computers that we used were silicon-graphic machines, and they were the size of a small refrigerator and cost more than $500,000. For a long time, virtual reality technology was viewed as scientific inappropriate approach, that it was gaming, it was entertainment, it was something from science fiction and not quite here yet. And that sort of caused some people to think it was inappropriate, that medicine needs to be much more serious. And the reality is these are very powerful tools, and we could see the potential. So the digital health revolution has been moving along really for several decades, but it's now just surging forward, and VR is one of the key components to it. It's very exciting for me to see that we're finally at a point of time where the enabling technology is both more comfortable, very powerful, and affordable. What I'm most excited about is seeing how virtual environments can be used to address some very difficult problems that we haven't had as effective tools as we'd like, such as neurorehabilitation and cognitive rehabilitation. The ability to capture movement dynamically, to be able to build beautiful environments that motivate a user to do the difficult task of recovering from a traumatic brain injury or from a stroke.
Systems are also being designed for friends and family to join the patient during their VR experience. And Dr. Greenleaf hopes these multi-user experiences could be developed further to create virtual support groups.
Virtual environments will allow us a very amazing way to connect patients, not just with the clinical ecosystem, but with each other. We can have a person be in a multi-user virtual environment but show up anonymously as an avatar. So that allows us in a very comfortable way to have support groups. So for people who might be struggling with addictions, not only can we use the virtual environments as a way to teach them situational confidence and learn refusal skills and learn to get on top of their cravings and resist peer pressure, it also allows them to connect with other people who are addressing the same challenge and share their stories. And for someone who might be in a small town or who's very concerned about privacy, being able to get this sort of support in a anonymous manner that's protected is going to be so important.
Hey, Doc.
Yeah, I didn't know anything about virtual reality until about 6 years ago when a guy named Walter Greenleaf came to my lab and he said, we have this thing called VR, check it out.
Dr. Brennan Spiegel has been developing VR treatments after experiencing the power of virtual reality firsthand.
I realized VR has this incredible, uncanny ability to nudge the human brain into believing things that seem fantastical or impossible. And while it could be used for entertainment or for gaming, it also could be used to support human health in ways that we've been discovering ever since then.
Now, Dr. Spiegel and his team research and administer clinical VR tools targeting pain management.
We've treated now over 3,000 patients with VR for both acute pain and for chronic pain. So you imagine, for example, somebody who's undergone an operation for a bone fracture or anything, and they're in the post-op area experiencing pain, and the first reaction is to reach for medications. But sometimes we realize we have a pharmacy in our own body. We have natural opioids coursing through our body, and if we had a way to deploy those opioids, those painkillers that we have in our spinal cord, without having to always reach for another opioid, that's what we recognize as an opportunity. When we first started using VR, we found that over 80% of our patients found it positive or beneficial. If I had a pill where 80% of the people right off the bat felt a positive experience, that would be an absolute blockbuster drug.
Dr. Spiegel's patient, former Air Force Colonel Tom Norris, has suffered from chronic pain for over 30 years and has had positive results through VR treatment. Tom puts on the VR headset and is then immersed in a virtual reality environment that both distracts him from his pain and teaches him useful coping tools.
The first time I used VR, I was initially taken aback because you're enclosed in a black environment. Then when they started doing the breathing exercises, which I believe was one of the first things, they had included on the headset sensors to measure your exhalation and your inhalation. And the application showed the breathing process as little tiny motes of light. And I got entrapped, basically, by the scene and the ability to see my breath in motion. It sucked me right in, to be honest. When you see your breath in motion, and then you see an effect caused by the motion of your breath, in this case would be a tree would bloom or colors would change, it reinforces the idea that something positive happens when you breathe in a VR situation.
It works. There's no question about it. You can see it in the body expression. You can see it in the breathing rate. You can see somebody just sort of relax into bed and their blood pressure drops, their breathing rate slows, their heart rate slows, and they're having a physiologic response. Not just a cognitive response, but a physiologic full body reaction to being in the virtual reality.
But while VR has been a successful tool for this patient, Dr. Spiegel doesn't want people to develop dependencies on virtual environments.
We don't want people to live in virtual reality forever. We don't want people to have to keep reaching for VR the way they might have to reach for, let's say, a pain pill. Because eventually people will get bored of being in virtual reality or be so familiar with the worlds that they're in. When VR is effective, it's actually teaching people about their mind and body and the connection between the two. VR is effective when we're training people how to live in real reality, or RR, more effectively, to have a richer experience in the real world.
There are also questions about how VR will fit in with existing healthcare systems.
I'm sure there are some people that are concerned that the use of virtual environments in medicine will displace or replace the need for us to have clinicians involved. And that's not going to happen. It's going to be a very powerful tool to extend their reach and extend their abilities to help their patients. If we design our systems right, it should also save them time. I think that's something we have to be careful as we roll out this next wave of technology. Is there is an existing medical ecosystem, And anytime you bring something new into it, you need to make sure that it reduces cost and makes things a little bit smoother and a little bit easier.
At this point, I don't think we need more science. What we really need is insurance companies to recognize the benefits of VR and to pay for it. We need to train more clinicians in how to use virtual reality. We need to come up with the protocols and procedures for how to deliver this new treatment to patients, both in the hospital and as outpatients. And that's what our team is working on, is how to actually implement virtual reality as a new branch of medicine.
We know that there are a lot of people that have challenges in terms of mental illness that, will never seek therapy. I think the World Health Organization has estimated about 600 million people have mental health conditions on the planet right now, of which fully 2/3 will never see the inside of a therapy office. Can we use technology to get them in there, or to get care to them in a way where they can get over these challenges that have limited what they can do in everyday life, and to make their life more meaningful? So that's a very exciting prospect as we move into the future.